Doesn't issue daily information on how many people have fully recovered, but other countries do. According to the latest French public health statistics, for example, of 82,000 confirmed cases, 21,000 people have fully recovered so far after leaving hospital, and many others are on the mend. But that doesn't capture the whole picture. Take a large-scale study from Wuhan in China in February, which covered 44,000 people. It showed that 80% of diagnosed cases had only mild or moderate symptoms, which didn't require hospital treatment. Now, the WHO thinks overall hospitalisation might be higher than that, but it still makes survival rates seem more positive. And there's more. We also know that many people infected with the virus show no symptoms at all. Until we have reliable antibody tests, we don't know how many, but on the cruise ship the Diamond Princess in Japan, for example, nearly 20% of all positive cases showed no symptoms at all. Now, that's a fairly small sample, but it's reasonable to assume that in the UK and other countries, eventually tens, perhaps hundreds of thousands of people will similarly be infected but show no symptoms. Now, scientists are looking at all of this, and the best data at the moment still appears to be pointing towards an estimated overall fatality rate of roughly 1%, maybe lower, which means, don't forget, a survival rate of about 99%. Now, those numbers are obviously not nearly as good for people who become seriously ill and require intensive care. A UK study showed that of 2,249 patients admitted to an intensive care unit, 344 were discharged alive from critical care, while 346 patients died. The rest were at that stage still being treated. Now, there are important variables to take into account: age, underlying health conditions and so on. But it means there is data which suggests that roughly 50% of all people in that study who've left ICU have died. But a separate study of ICUs in Italy showed slightly different figures, and the UK study suggests that if a patient does not need mechanical ventilation in the first 24 hours of intensive care, the survival rate goes up to at least 70%. Make no mistake, anyone in ICU is seriously ill, but many people who go into intensive care will survive. And in the wider community, the overwhelming majority of people who are infected by this virus will go on to make a full recovery.